Hey everyone, this is Haley speaking, and I will be introducing the Project 5 presentation for my group. We split the presentation into 3 sections of discussion, beginning with me summarizing facts and statistics from the influenza outbreak of 1918. Next, we move on to a timeline of pandemics throughout the years created and presented by Jordan. Finally, Emily will discuss similarities and differences between the outbreaks and conclude our presentation. So, as we've all come to know through research in this class at the very least, Clemson University has a rich history filled with interesting and relevant information, some of which can be used to assist us with present-day issues. This multimodal research project was designed to look into the history at Clemson University and develop a topic to research and discuss as a group. Our group decided to research and compare the influenza outbreak of 1918 and COVID-19. More specifically, we were focusing on Clemson's response to each of these outbreaks, as well as similarities and differences between the influenza pandemic of 1918 and COVID-19. Some of the specific questions that we researched for this project were: what emergency procedures or medical procedures were put in place to attempt to combat and resolve the outbreak in 1918 compared to 2020? Who was most affected by the influenza in 1918, and how many people were affected? And finally, how many casualties were caused by these pandemics? To begin this discussion, we need to know more about the influenza pandemic that erupted in 1918. I found all of my facts and information on the Centers for Disease Control Prevention webpage, or cdc.edu. This flu was known as H1N1, and it came from an avian origin. It infected about 500 million people, which was approximately 1/3 of the world's population. In 1918, there were no flu vaccinations to protect against this flu virus. There were no antiviral drugs or antibiotics to combat any infections obtained while infected with the flu virus, and there were no mechanical ventilators like we have access to today. This meant that all control efforts to stop the spread of this virus were limited to isolation, quarantine, good personal hygiene, limited social gatherings, and the use of disinfectants. These guidelines are very similar to what we are being ordered to do in our current pandemic. The 1918 H1N1 pandemic produced the greatest influenza death total in history, killing at least 50 million people, 675,000 of which were Americans. There was an especially high mortality rate among young adults ages 20 to 40 years old in this pandemic, which was an unusual characteristic of this virus at the time. The virus lowered the average life expectancy in the United States by over 12 years. Pictured above is a line of nurses waiting to treat patients that I found on the Centers for Disease Control and Prevention webpage at cdc.gov. World War I was also happening during the time of this epidemic. There was a shortage of medical personnel due to many of the doctors and nurses serving in the war. There were actually more deaths caused by influenza than were killed in battle in 1918. The picture below was also found on cdc.gov. It is an ad to attempt to recruit nurses to aid in the shortage of medical professionals during this time. To summarize the outbreak in 1918, the rapid spread of the influenza virus and the limited techniques and tools to prevent and treat this flu created a huge public health crisis. But since the flu pandemic of 1918, the world has made major advances in the science of flu prevention and control. Now, I'll turn it over to Jordan with Clemson and pandemics over the years.
I will be discussing how Clemson's reaction to pandemics has changed over the years. Clemson has an influenza pandemic fact sheet published in 2007, which mentions 3 major flu pandemics since 1918. There have been other pandemics since then, for example, Ebola, but because corona and the flu have similar symptoms of virality, I'll be focusing on Clemson's response to the flu and corona outbreaks. I'm going to focus on 5 major pandemic outbreaks as listed: the 1918 H1N1 Spanish flu, 1957 H2N2 Asian flu, 1968 H3N2 Hong Kong flu, 2009 H1N1 swine flu, and 2020 COVID-19 coronavirus. The impact and severity of each outbreak differs greatly, and therefore each response is different. However, I want to focus on the evolution of Clemson's response with their use of resources and communication of faculty and students. I'm going to describe each outbreak. According to the Clemson influenza pandemic fact sheet, the Spanish flu had a death toll of 675,000 in the US and up to 50 million deaths worldwide. It was very contagious, and because of this, Clemson took action and closed campus. Unfortunately, the flu spread to Clemson through SATC ranks and throughout the Clemson community with around 150 cases. Students that were sent home because campus was closed also got the flu from the community. Due to this impact, campus buildings such as Serene, the Trustee House, and the chapel were used as temporary hospitals. Thankfully, due to preventative measures, there were only a few deaths on campus. According to the fact sheet, the Asian flu caused about 70,000 deaths in the US and anywhere from 1 to 2 million deaths worldwide. Clemson's reaction was not as drastic as before with the Spanish flu because the spread of the Asian flu is not as viral. This fact could be due to advances in hygiene, medicine, and technology. Because of this, Clemson stayed open, but lessons learned from this outbreak have been used for practical insights for recent outbreaks, such as swine flu and coronavirus. The fact sheet stated that the Hong Kong flu had a death toll of about 34,000 in the US and 700,000 worldwide. It was much less viral than the 2 flu outbreaks prior. This is because the virus gained momentum during the holiday season in December. Students were not at schools during this time and therefore not spreading the virus amongst each other. Clemson did not have to close campus because it gained momentum in between semesters while students were at home for the holidays. According to the CDC, the swine flu had a death toll of 12,000 in the US and anywhere between 150,000 and 575,000 worldwide. As years go on, the impact of the flu virus decreases because medicine has been studying the flu strains for decades and producing vaccines. However, the strain was not like the ordinary seasonal flu. It had a unique combination of genes not previously identified in humans or animals. As a response, Clemson set up a website to update students and faculty on the outbreak. Clemson also organized a pandemic planning group called Clemson University Pandemic Response Plan. The goal of the planning group was to ensure the health and safety of faculty and students. Their job is to also assure the continuity of operation and academic programs throughout the pandemic event, and provide a timely and efficient recovery following the event. The Clemson influenza pandemic fact sheet, which was published in 2007, 2 years before 2009 swine flu, provides extensive information about flu symptoms, potential challenges with usual services being interrupted, and preparation techniques in the case of an outbreak. It also discusses the potential of businesses and schools being shut down and provides methods to deal with those challenges, and provides extensive information about prevention and treatment. Clemson was much more prepared for an outbreak than it had been with previous pandemic events due to lessons learned from the past. Because Clemson was more prepared and technology was more readily available, Clemson was able to give frequent updates via websites, Twitter, and email on the situation. Communication between the school, faculty, and students changed dramatically. The most recent and current pandemic, coronavirus, has a death toll of 12,000 in the US and more than 158,000 worldwide as of April 18, 2020. We expect the number to continue to increase as it continues to spread and more cases have an outcome. Little is known about coronavirus in contrast to the flu. Because of this, the virus is able to gain great momentum and quickly spread around the world. Clemson closed campus and moved to online instruction to protect the health and students and faculty. Study abroad programs were brought to a halt and students returned to the U.S. As with the swine flu, Clemson gave updates on the situation via website, Twitter, and email. Technology has allowed us to continue to learn remotely and maintain good communication between students, faculty, and the school. As time goes on, Clemson's response to outbreaks will continue to evolve due to advancement in resources and the information gained from prior experiences. The major trend I would like to emphasize with this information is that Clemson's response has evolved along with technology. The 2009 swine flu and 2020 coronavirus outbreak are clear examples of this fact, as Clemson took advantage of the opportunity technology offered and used it to keep everyone healthy and safe while ensuring the continuity of our education.
Now I'm going to be talking about the differences and similarities between the influenza outbreak of 1918 and the coronavirus COVID-19 outbreak of 2020. Influenza versus COVID-19. It probably seems like a coincidence that Clemson has had a previous experience with a pandemic given the current state of the world today. However, hopefully it is now clear that over the years, Clemson has seen its fair share of disease outbreaks and has had to learn how to cope with these emergencies. Despite having some understanding of how epidemics and pandemics will affect their campus, COVID-19 has brought about an entirely new set of challenges for Clemson University, and Clemson's response to COVID differs significantly from their response to the influenza outbreak of 1918. How are the influenza and coronavirus pandemics alike? They certainly look alike under a microscopic view to the eye of a layperson, but the two diseases are similar in more ways than one. Taking hospitals by storm. One of the biggest ways in which the two pandemics are similar is in lack of resources and materials in healthcare facilities. With such a rapid and massive quantity of patients coming into hospitals at once, it was hard back then for healthcare workers to come up with enough supplies to treat all of the patients efficiently, and we are facing this same struggle in 2020. Hospitals quickly use up materials like ventilators, respirators, masks, sanitizers, and other necessary supplies. Doctors both then and now abandon their specialties to work towards the same general cause, diagnosing and prescribing for influenza or the coronavirus. Whether it be non-emergent surgeries put on hold in 1918 so that patients with influenza could inhabit every room in the hospital, or patients lining up in their cars to receive coronavirus testing today to avoid overcrowded doctors' offices, the world was and still is struck by the vast amount of people in need of help during the pandemics. Similar symptoms. One of the most talked about similarities between influenza and coronavirus is the symptoms they possess. Especially in the early stages of the coronavirus pandemic, people compared the two diseases and even went as far as to say they are virtually the same. Some basic similarities between the symptoms for COVID and influenza are both diseases often cause a high fever, a dry cough, fatigue, congestion, and respiratory problems. However, the most distinguishing characteristics between these two diseases are the incubation periods, 14 versus 4 days for COVID and influenza, respectively, and that respiratory problems and shortness of breath are more common in COVID patients, despite the frequent cases of pneumonia that stemmed from the Spanish flu in 1918. Clemson University. Both influenza and coronavirus threw the world into a frenzy, causing people to cancel vacations, universities to suspend classes, and lives to be turned upside down. The biggest similarities and differences between the two pandemics might both lie within the reactions of the Clemson community. Newspapers from Pickens County in 1918 showed that everyone was trying to get involved and do their part to ensure safety and quick resolution, just as we all are today. Welfare workers are stepping up to help soldiers at the time of the influenza outbreak, and today people are making masks at home to send to healthcare workers and military personnel working on the front lines of the coronavirus pandemic. Classes were suspended at Clemson during the time of the influenza outbreak, but it was much less of a formal procedure then compared to now. Students weren't going to classes because everyone had to put their lives on hold to support the world during the pandemic. Today, classes were canceled for the semester, campus was evacuated, and tuition refunds were issued to students and their families because of coronavirus. Now, how are the two pandemics different? Appearance of new viral strains. There are a large variety of strains of both coronavirus and of influenza. Some are more devastating than others, but the main difference in the varying strains of each disease is the rate at which they mutate and the number of severe mutations of each disease. Coronavirus is one of the 7 known human coronavirus strains. It is the most novel and the most severe of the 7. It specifically causes what we are now calling COVID-19 and is a result of the other strains mutating. Influenza has been mutating for much longer than coronavirus and has many strains. The main difference is that it mutates, but antibodies are more universal among strains and the symptoms are more manageable, just not with the technology and circumstances available in 1918. Technology and communication. Our medical community today is able to offer care that is more than just merely supportive care, which is all that was able to be offered for influenza in 1918. Doctors, nurses, and healthcare workers alike are working towards healing patients, not just making them comfortable as they lie on their deathbeds. The goal today is to learn more about antibodies and develop a vaccination, whereas the goal in 1918 was sedation and stimulation to ease the pain of influenza symptoms. Healthcare workers are administering coronavirus testing to patients in their cars, which was something that would have never been thought of in 1918. The technological advances of 2020 have allowed our healthcare system to share simple notions with us, such as wash your hands and stay inside, which wouldn't have been able to as easily been shared in 1918 because of lack of media. Clemson University. Clemson's main source of communication between faculty, administration, and students and their families was newspaper and physical letters in 1918. Clemson's catalog from the 1917 to 1918 school year recounts how they utilized these resources in the event that information had to be shared in relation to the university. As we know today, snail mail is not the most useful in times of emergency, like a pandemic outbreak that would impact a college campus. Today, we are at an advantage because the university has the capabilities to send out email, text, or Twitter blast to thousands of contacts to update those who it may concern about changes to normal campus procedures. Clemson in 2020 has remained cool, calm, and collected about the outbreak, no matter how heartbroken the Tigers may be that the year is over early. In comparison to 1918, Clemson's reaction to coronavirus seems more thorough, organized, and has a lot more restrictions involved than in the past. All in all, Clemson is definitely familiarized with pandemics and epidemics at this time and has definitely come a long way in their reactions and responses.